is Farzana Yasmin from ICT. Welcome to all to my presentation. Today I'm going to present one of my study findings of an integrated intervention titled Feasibility, Acceptability, and Scalability of the Implementation of an Integrated Wash, Nutrition, Prevention of Lead Contamination and Child Stimulation to the government health system in Bangladesh. So my presentation will cover background, objectives of our study, RINEW-G intervention at a glance, the methods, the findings of our study, and conclusions. The objective of our study was to assess implementation of the integrated intervention by government frontline health workers. We explore job satisfaction, the experiences they gathered from the session delivery, and the population demand for sessions. We also try to identify the barriers and facilitators to utilize a government health system infrastructure and resources. This is the background of our study. Actually, the single intervention implemented by the government health service providers conveyed by government health service providers seemed effective. And we piloted RINEW multi-phase research in 2017 in rural Bangladesh to investigate the impact of the integrated intervention. After the pilot, we aim to explore the intervention, the feasibility, acceptability, and scalability of the integrated intervention. From these slides, you can have a look at a glance of the intervention. Actually, we implemented our intervention to the pregnant woman and the lactating mothers. To the pregnant woman, we conducted 4 sessions, and for the pregnant lactating mothers, we conducted 24. Our design was for conducting 24 sessions, 12 main sessions and 12 follow-up sessions. For the pregnant mothers, the intervention was implemented by the family welfare visitor and the midwives. And for the lactating mothers, the intervention was delivered by the community healthcare providers, sub-assistant community medical officers, and senior staff nurse. The pregnancy session actually held on Union Family Welfare Centers and the Upazila Health Complex, and the sessions for the lactating mothers were held in Union Family Welfare Centers, community clinics, and Upazila Health Complex. Now I want to share with you the methods. We conducted 17 interviews with community healthcare providers to know their job satisfaction, their experiences to deliver the sessions, and the population demand for the sessions. We also conducted 9 key informant interviews with the supervisors, managers within the government health system to know their views on the integration and the feasibility of the implementation through the government health service providers. We also conducted 4 focus group discussions with the lactating and pregnant mothers to know the acceptability of the intervention. So these are actually our participants. We conducted key informant interviews and in-depth interviews with the implementers. The implementers were the government health service providers and the national and sub-district level supervisors and managers, and the managers from ICT as well. And we also conducted focus group discussions with the study participants who were actually the pregnant women and the lactating mothers. From this side, you can have a flavor of the categories of the managers. We conducted the interviews. There are 3 types of managers. Those are national level managers and sub-district level managers, and CDTLB managers actually who worked in the implementation for RINEW-G study. From these slides, you can have a look on the categories of the service providers. So we conducted in-depth interviews with the family welfare visitors, with the midwives, with the community healthcare providers, sub-assistant community medical officers, and senior staff nurse. Now, I want to share with you the findings. At first, I want to share the in-depth interview findings. The in-depth interview was conducted with the community healthcare providers. The health service providers of government mentioned that the group sessions seemed almost similar with their routine health education session, which made them more comfortable, and providing RINEW group sessions increased their confidence as they could integrate it with their regular work. They also mentioned that the session participants, I mean the mothers, participated the play activity during the sessions attentively and with enthusiasm. Now I want to share with you a few quotations. And you can so that you can have a flavor of our findings. Here you can see one of our community healthcare providers said, I used to be shy to talk in front of people, but after receiving RINEW-G training, I know how to communicate with mothers. I feel so confident that now I can talk even in front to thousands of people. Now I have the confidence that I can do this work, and mothers also happily listen to me. I want to share with you another quotation. The health service providers of the government who delivered the intervention were satisfied with their job responsibilities, and mentioned about the necessity of the child development. They described how they explain child development with the example of a tree. One of them mentioned, as child development is the main thing, I explained that with the example of a tree, how it grows and develops branches, which is similar to the way a child develops. Now, the mothers might not be able to explain in bookish language, but each of them will be able to explain to their own language and understand if our child is developing well or not. In this slide, actually, I want to share with you the findings of the population demand for the sessions to the participants. So, according to the in-depth interviews with the government health service providers, they mentioned, from the intervention materials, participants like the picture books most. They mentioned mothers would be more motivated if the toys were more attractive. They identified one major problem was lack of water, sanitation, and hygiene facilities in the health facility center. You can see in the photos of the picture books, which was so popular from our intervention materials. This is from this slide, you can have the flavor of the problem identified from the in-depth interviews with the health service, government health service provider. They measure, one of the major problems they identified here is the lack of water, sanitation, and hygiene facilities. Locked off washroom is very common there. No facilities of drinking water there, and no facilities even for the children to cook. One of the community healthcare providers said there is no tubal for supply water, and participants need to go to anywhere else for drinking water, like nearby households. So it was very difficult for them. I want to share a few more barriers they faced. Actually, one of the health service provider mentioned that they faced problem with the child stimulation toys. mothers do not like it. So community care, healthcare providers mentioned that mothers didn't like it. They laughed at the toys. One of the community healthcare providers said mothers even they laughed at me and say that they will not come for these toys only. Now, I want to share a few findings which we collected from the key improvement interviews. So, majority of the service providers were motivated to the service motivated to conduct the sessions. They stated that they very few complained about the workload earlier, but gradually they could integrate it with their regular work. Now, I want to share a few quotations from our key informant. From this slide, you can have a look. He is one of our key informant, designated Upajala Health and Family Planning Officer. He mentioned about his achievement to say that I could make them understand that if they have 10 works, RINEW-G is also one of those. So they could integrate RINEW-G intervention with their regular works. Now, I want to share a few of our findings from the focus group discussions, which we have conducted with the study participants, the pregnant women and the lactating mothers. Um, so, most of the mothers say that it is feasible for them to attend the sessions, though very few stated that the service centers were far from their house, so difficult for few pregnant women to go to the service center. And they also mentioned about the positive and friendly attitude of the service providers. Now I came to the end of my presentation. To conclude, I want to say, yes, we faced huge challenges, and we also took challenges to implement this integrated intervention through the government health system. But this integrated intervention implemented through the government health system of Bangladesh seemed feasible, acceptable, and scalable. Finally, I want to thank our donor, Bill and Melinda Gates Foundation, and ICDD will be always grateful to its all donors. Thank you all for your patience and have a good day.